The larger issue becomes how society helps integrate people back into the families. What is society, through legislation, insurance issues, how are we going to advocate for, as a group, as a social group, how are we going to advocate for better integration of the person after the brain injury back into the community? And the best way family members do that is to get involved in advocacy organizations. You know, it's the squeaky wheel that gets the grease, and there's no way around it. You may think your situation is obvious to other people, but there's hundreds and thousands of other people clamoring for change and for attention to their own causes. And the only way you get change is by fighting for it. And that requires effort in itself, but in the end, the benefits of that effort far outweigh the costs of everything you have to put into it to help that advocacy be successful. So that's another piece of what you can do. If you feel frustrated by the situation you're in, maybe you feel that the healthcare community isn't doing as much as it should for you, well, get out there and fight for what you believe in and cause change that you think will be effective. And that's a real important message that caregivers need to hear. And if we also, in the process, change society's attitudes about people who are different than us. And I think that the best societies accommodate that difference. It's big enough and the rules are clear enough that they allow us not to shun people like that or to put them in closets or away from us. They allow us to keep people like that in the streets and not house them, whether it be older people in nursing homes or younger children with severe disabilities or adults who have had traumatic brain injuries. They're all part of the larger social community, and the ease with which we recognize that and the comfort that we can bring to our own personalities and how we deal with that is only going to improve the situation for people after a traumatic brain injury. And as I mentioned before, many of our vets, even with fairly large lesions, were very successful in their lives. And I think there are a lot of myths that persist about the effects of brain injury and how it disables a person. But in fact, we tend to focus more on the able part of disable, not the dis part. And I think family members have to keep that in mind. The patient has to remember that, and the society at large has to accept that. And when that happens, it'll also be a lot easier to rehabilitate people and to have better outcomes.